Hi, my name is Johan van Zyl, and today we will be doing the third part of our series on the pillars of balance. And today we will be focusing on proprioception. And let me just backtrack what I call the pillars of balance. I also call it the triangle of balance. And the reason is that your vision and of course your vestibular system and your proprioception are all systems which actually help you to navigate your world, move around in the world comfortably without thinking. So today we'll be focused on proprioception, and proprioception is also called your body's sixth sense. Now, why is this? If you have ever seen somebody that has got a vision problem, or might be blind, you will always see that they are feeling, that they are touching, that they are trying to sense the environment. Now, proprioception is that sense that if you want to walk and you don't have proprioception that's working properly, you have to think about the whole time whilst you're walking. You have to look at the ground. You literally have to think about placing your feet in front of each other. Now, that is what proprioception enables you to do. It lets you walk and move around the world without you even thinking about it. And how does this actually work? Now, it's also called kinesthesia. And if you can actually do a simple little test like this, for example, if you take your elbow and you can touch your elbow with your finger, you might find that your proprioception is actually working pretty well. I'm actually quite surprised myself. Your body knows precisely where your limbs are, which is, if you think about it, quite crazy. So you're actually moving around, you can't see your limbs, you certainly can't hear them. Your vestibular system is not working in that regard. It's your proprioception that actually tells your mind, what are your limbs doing? Where are they? Now, how does proprioception actually work? There is sensors and receptors in all your muscles, your tendons, and your joints. And these sensors and receptors can detect how, where, and what your muscles are doing. All the proprioceptors then send some signals to the central nervous system, and from there on it integrates with your vision and your vestibular system so that you are able to move comfortably around in your world without falling or having balance problems. And this is why I call it the pillars of balance, because all three systems needs to be working effectively, especially as you grow older, to enable you to walk comfortably and operate in your world. And now we will be dealing with some proprioception disorders. How do you know that you might have a proprioception problem? Well, as mentioned, you might have some difficulty walking across uneven surfaces. You might be changing your gait. You might be looking down whilst you are walking. Be much more aware of your environment. And of course, one of the things, you can't judge or understand your own strength. Sometimes you might find that you hold something too tight. Other times you might find that you grab something and you think you got it and you don't actually have it. So that feedback system from your muscles that tells your brain how hard to grip, when to stop, that system, your proprioception system, that system might not be working properly. Now, uncoordinated movements. If you are a little bit like uncoordinated, if you are clumsy, if you are walking around and you're continuously looking for a chair or something like that, it might be that you also have a proprioception disorder. Now, what conditions might lead to proprioception disorders? And unfortunately, one of the most common ones, and this is what we all have as we grow older, is literally getting older. Now, getting older, unfortunately, you can have a vestibular problem, or you might have a binocular problem, or you might have a proprioception problem, and they might all actually work together to cause you problems. But if any of those three systems aren't working good, the other two systems very often has to take up the slack. And if you don't then train those systems to take up that slack from the one system that isn't working, you might have some more problems then. Now, what type of conditions, except getting older, can actually cause proprioception disorder? Multiple sclerosis. Again, something more often when you get older. Parkinson's disease. Strokes. Brain injuries. Traumatic brain injuries. Arthritis, joint injuries, and of course, hip replacement surgery. Now, this is not commonly understood, but certainly it can affect your mobility. And lastly, of course, peripheral neuropathy. Now, I've made a video on my own journey of how I started walking barefoot. And if there's some advice I can give you today, is try and monitor your gait. Monitor how you walk, because that will tell you very quickly if you are developing any walking problems. And when it comes to proprioception, that is certainly something that you want to look at often. Now, on the iPhone, you have your health app, and on your health app, you have a thing called the double support time, and you have also a measurement called asymmetrical walking. If you are on the Android system, there is also an app available called One Step. It's a free download. I'm not really knowledgeable on the Android system, but on the iPhone system, on my iPhone, I know precisely. I look at my iPhone quite often and I check my walking pattern. And if I know that I've done something where my feet's uncomfortable, my phone picks it up immediately. And I will show and share some data on my own personal experiences on the iPhone. But yes, today you have modern technology which can measure how you walk. And those measurements are very, very critical to actually understand if you are going backward or are you making an improvement. So use technology to measure your step pattern. Right, and now we will be doing some tests to determine if you have a proprioception disorder. But always remember, in our practice, we focus on binocular vision first and foremost. So our emphasis is on binocular vision, but we see a lot of patients that have balance problems, vertigo, and this is why it's become important for us in our practice to not just look at binocular vision, but also look at the vestibular system, and we do some very simple, easy exercises and tests to determine if you have a binocular vision problem or a vestibular problem, or in this case, a vestibular and a proprioception problem maybe. Now, there are numerous tests that your doctor can do to determine if you have a proprioception problem. But one of the easiest one I just explained to you is literally just closing your eyes and lifting your elbow and just taking your finger and putting it on your elbow. So you want to know, is your body awareness working? Now, there's basically just two tests that we do in the practice ourselves, but you might be doing a joint position recognition test at the doctor. And again, that's easy again. You just close the eyes and the doctor's going to take your finger or a joint and move it in a certain angle. And you need to then tell him what's the angle, what's going on. Now, a thumb finding test. Again, you can just literally take your thumb and then take the other hand and then put the one finger on it and then put the other finger on it and then the other finger on it. And you are closing your eyes for this test. You are cutting the vision out, but your vestibular system, your balance system, your spinal system will also now enable you to stand upright and at the same moment in time also enable you to know where your arms, your fingers, and your legs are. Now, the two tests that we basically do in the practice, we only do the Romberg test and the balance error scoring system test, the base test. The doctor might do another test with you, and some of the times when you do a sobriety test, they do the same thing to see if you are sober. It's called the walk and turn test. Now, let me just tell you what we do in the practice to determine if you might have a larger proprioception problem. So the Romberg test, very simple. You stand with feet together, you place your hands across your chest, and you close your eyes. And when you're closing your eyes, you need to now basically use your vestibular system and your proprioception to enable you to stand still, not to sway too much. And I must say that after my retinal detachment and my feet problem, I am finding this a little bit more difficult than what I anticipated. Now, this is the Romberg test. There's also different versions of the Romberg test. And the other test that we basically do is the balance error scoring system. Now, you need to do this test on a hard surface, or you can do it on a soft surface, which makes it far more difficult. We only use part of this test. We do it on a hard surface. So again, basically what you need to then do is stand with 2 feet and place your hands on your hips. And for this test, you want to see what is the patient doing. Now, normally it's done in a 20-second series of tests. So for 20 seconds, you need to be able to stand with both feet together and close your eyes and not sway too much, very similar to the basic Romberg test. Now, this is the first test with your eyes closed, both feet on the ground, hard surface. As I mentioned, far more difficult when you are doing soft surfaces. Now, sometimes we've got to stand right next to a patient. When we do this, they might even fall, actually, or they might sway too much. So that should be about 20 seconds. And that is the first part of the base test, the balance error scoring system. Now, the next part of the base tests, the balance test series, is balancing on one leg, the non-dominant leg or the weaker leg, again for 20 seconds, and observing what does the patient do. So you want to be standing basically with one leg like this, and watch if the patient is moving around too much or touching the ground. Now, this is actually very difficult, and let me see how I'm doing today. Again, you need to put your hands on the hips, and I'm going to raise my strong leg, and I'm going to now close my eyes and see if I can stand on one leg for 20 seconds. Now I can't, so that's one error, that's 2 errors, and that's 3 errors. And I'm swaying too much, that's 4 errors. This leg is getting a workout now. I'm finding it very difficult. Okay, and that's about 20 seconds now. So I've got 5 errors. Now you can only allow 10 errors. And if you do 6 tests, so 3 on a hard surface and 3 on a soft surface, the maximum that you can have is basically 60. And the lower the mistakes that you make, or the balance problems, or the errors, the better the score. So I've made, I think, pretty well on the first one with 2 legs on, because I think my strong leg was actually supporting my weak leg. And now on the second one, I had much more errors. And the final part of this test is literally just placing the one foot above and in front of the other one. And you now want to do like on a straight line. And again, hips nice and straight, and you want to put your weaker leg or your non-dominant leg at the back and the stronger one in front. Be upright, and let's see if I can now do this now for 20 seconds like this, with eyes closed. And I'm certainly finding it pretty difficult and nearly went there. But again, my strong leg is actually now helping a lot to try and balance me out. And I think that must be nearly about 20 seconds now. Right, so that is the best test. And it's called the balance error scoring system. And you can also do it on a soft sponge-like material. And it is far more difficult then. And I think I personally have to do some balance exercises on my weaker leg. Now, what do we advise our patients to do if they do have a proprioception disorder? We always like to do the basics. So the first thing is always make sure your diet is good. Because if your nervous system is not good, you're going to have a balance problem. And you will not believe it, that the Romberg test sometimes can actually pick up if you've got a vitamin B12 deficiency. So make sure your vitamins are there. Now, again, what we tell our patients is swim. Swimming, excellent. Do some balance exercises. Do yoga. Do some stretching exercises. But this is not our main focus in the practice. We always go back to binocular vision first and foremost. And we do find that if we do the binocular vision and we do some vestibular exercises, which I've explained in my previous video, and with some very basic balance exercises, we find remarkable results with our elderly patients that will improve their gait, their stability, their balance, and of course gives them much more confidence in walking around. And this is very important. You do not want to be falling, or there's a risk of falling. You want to reduce that when you grow older.